Hello and welcome to the Public Health Internship Orientation video. This is the Public Health Internship prep that you will do for undergraduate internships in the College of Public Health. Note that this video is narrated, so adjust your sound as needed, or you can also view it with closed captioning, and you can do this through YouTube viewing options on publichealth.arizona.edu/undergraduate/internships. I'm Dr. Laura Gronwald. I am the internship instructor and coordinator, and I am excited that I'll be guiding you through your internship experience, from searching for an internship to securing an internship, to participating in our internship class online with some activities that support your learning on the internship site. I'm really excited to work with you. I really like this part of my job because I know that the internship is such a valuable learning experience and really supplements the work that you'll be doing in your coursework in public health. And so I'm here for you and really excited to be here. A little bit of information about me. I've been an educator for nearly 20 years, both in college and community settings. My academic training is in writing, in cultural criticism and critical thinking, and college teaching. I have taught first-year writing. I've taught students in civic engagement courses where they're doing field work and also doing work in the classroom, similar to this internship experience. I've also taught gender and women's studies, literature and film, and I will be teaching a writing course for public health students starting in the spring, where we will look at public health narratives and how to write compellingly in the field of public health. As a community educator, I did a lot of work teaching social and emotional skills, including workplace training. So I've got a lot of experience doing that as well. And I have supervised students both from the U of A side of things, and I've supervised interns when I worked in a community organization here in Tucson. So I've really seen a lot of sides of this, and I am here to help you strategize and support you throughout this whole process. I want to read this land acknowledgement statement before we go any further. The University of Arizona sits on the original homelands of indigenous peoples who have stewarded this land since time immemorial. Aligning with the university's core value of a diverse and inclusive community, it is an institutional responsibility to recognize and acknowledge the people, culture, and history that make up the Wildcat community. At the institutional level, it is important to be proactive in broadening awareness throughout campus to ensure our students feel represented and valued. Now, I'm going to go over the process of getting an internship set up, and what this overview will include is what counts as a public health internship, how many hours interns need to complete, how to find and secure an internship, what forms you need to complete to get enrolled, and some other details as well. There's an accompanying worksheet that you will find on the public health webpage, and I advise completing that at the same time you're watching this video. So you're going to want to maybe take a moment to pause this video and print out your worksheet now if you haven't done that already. What the goal of this worksheet is to ensure that you understand the content of what's going on in this video, and also allow you time to have follow-up questions with me. So go ahead and print this out if you haven't. Pause the video and start the video again when you've got your worksheet. What is public health? This is really an important question to ask ourselves in the study of public health, and also to be prepared to answer, because there are a lot of people who you may approach in the community who won't really know what public health is. So pause the video and take a moment to define for yourself what is public health. Okay, so as you will see, this is one of the very first questions on the internship orientation worksheet. Hopefully you have taken the time to answer that in your own words, because again, you're going to want to be able to have this conversation when you're approaching internship sites. So I will go ahead and give you a definition, a working definition of public health. It's the science and art of preventing disease, promoting health, and protecting and prolonging life through the organized efforts of society. So in public health, we focus on the 4 Ps you see here on this PowerPoint video: Prevention, this means improving the quality of life that people have through preventative measures. Promotion, the sociocultural factors that influence health and health behavior. And also the factors that influence our planning, implementing, and evaluating effective health education programs. And promotion also includes facilitating behavior change for a healthy life. We also focus on protection. That means eliminating disease and eliminating or minimizing accidents. So these are things that increase our awareness of the dangers of health behaviors like smoking, or really protecting our populations by promoting the nutritional value of foods. So populations at large understand this, not just individuals. And population, therefore, is the final P that we talk about. And this is important because practitioners of public health really carry out our mission of organized efforts to address the health concerns of communities of a population. So we're not just focused on an individual's health, we're really focused on a group of people's health and how those health factors can vary quite a lot from one population to another. So we want to make that more equitable and fair, so that we have better public health outcomes overall for our society. So public health focused also means a variety of classes and courses and topics that you've encountered in your public health major. These are things like biostatistics, environmental health, epidemiology, global health, health disparities, health education, health policy, health promotion, occupational safety, nutrition, and wellness. So if any of these are not familiar to you but seem intriguing, make sure you talk with your academic advisor so you can start looking into coursework that will help you really flesh out what your public health interests are and make you very well informed as a public health major. When you're considering what kind of internship has a public health focus, consider the diversity of classes that you've taken throughout your undergraduate degree. Ask yourself if you can answer this question: is there a clear connection between this internship and public health? If there's not a clear connection, it may not be a public health appropriate internship, or you might just need to do a little bit of work to turn it into a public health focused internship. So you can also think about this in the context of, did I gain public health knowledge in my courses that will help me be successful in this internship? If you can say yes to that, then that will help you know that the internship you might be interested in is public health focused. And you want to narrow down and make sure that there's enough content in the internship to make it qualify as public health focused. One of the questions that comes up a lot is public health focused internship versus a clinical health focused internship. Sometimes people in the community are even confused about this, and a lot of students have questions about this as well. So a public health focused internship is going to focus on the health of a population, and a clinical health internship will focus on the health of an individual. Public health focuses on health and wellness and how we can promote and prevent disease and promote health and wellness, whereas clinical health is focused on sickness. And so finally, just to get back to those 4 Ps, public health is focused on promotion, prevention, and protection, and clinical health is focused on diagnosis, and treatment. So it's really important to note that a clinical health experience cannot count for a public health internship experience. So for instance, shadowing a healthcare professional like a doctor, a pharmacist, a dentist, a physical therapist, or serving as a pharmacy or physical therapy tech, or otherwise delivering care to patients is not eligible to be counted toward public health contact hours or your public health internship credit. Now, that doesn't mean that you can't do an internship in a clinical site, because there are plenty of opportunities to do a public health internship at a clinical site like a hospital or a clinic like El Rio here in Tucson. It can still be public health related. But for instance, you might be doing something like a survey at the end of patients' appointments that would be asking about promotion, prevention, and protection versus being in those appointments themselves. So if you have any questions or concerns about what does qualify as a public health internship versus a clinical health internship, please get in touch with me so we can figure out a good fit for you that is clearly public health related and will help boost your career post-graduation. Why is a public health focused internship a requirement to graduate? So this is another question that students often have. and even people in the community as well? Well, there really are many reasons. The first and foremost is that it's great to get a hands-on experience outside the classroom where you're applying your public health knowledge. But a lot of colleges within the University of Arizona do an internship and require that. And that's because we want you all to have a practical application that helps you understand concepts from the classroom at a deeper level than someone who's just had classroom learning. For our purposes, it also really helps clarify your interest in public health to do a public health focused internship. You've taken a wide diversity of courses in public health, and this can help you narrow down which topics you're most interested in post-graduation as you think about a career or what's next. So finally, that's part of what this purpose serves as well. It helps you prepare for life after graduation, whether that includes graduate school, a career in public health, a career in another health-related profession, or even a career in some other field entirely. Having this internship experience, this field-based capstone experience, will make you more competitive for that next step in life. In fact, there's a lot of research out there that says that really that's what employers are looking for, is internship experiences. And finally, a public health focused internship really reflects our college's commitment to the community. We've had students doing internships for the last 30 years, and we know we have a really strong reputation in the community because of that, and we're excited that you'll be able to join that tradition. So there are a few different course options for how you complete your internship here in the College of Public Health. One is HPS 493A. This is the required internship, and you do need 6 units of HPS 493A to graduate. That's a graduation requirement. HPS 493H is the honors internship. This is the honors option of 493A, the required internship. And then we also have HPS 493B, which is an elective internship that you can do for public health elective or general elective credit. So HPS 493A, the required internship, as I mentioned, 6 units are required to graduate. You need to have all of these prerequisites here listed before the start of the internship. So that includes HPS 350 is completed. You have public health major status. You've completed the public health orientation internship. That's what you're doing right now, starting right now. And you have your work plan and all other forms submitted for approval from me, the internship instructor. HPS 493H, the honors internship, is going to have all the same prerequisites as HPS 493A, plus enrollment in the Honors College. And then do note that there is an extra honors assignment during the internship semester, and I will be in communication with honors students about that. And finally, HPS 493B, the elective internship. So again, noting that this is not required to graduate, but we often have students who sometimes choose to pursue an additional internship experience. Again, this can be general education credits, or this can be general elective credits for public health. The prerequisites here are HPS 178 is completed, HPS 200 is completed, and you have 6 other public health coursework units that you've already completed. You'll also complete this public health orientation and have your work plan and other forms submitted for approval from me. So there are a few different options for how you can earn these enrolled units for your internship credits in public health. The first option is that you can split your 6-unit requirement into 2 semesters for 3 units each semester, creating a 2-semester internship at the same agency. A second option is that you can choose to complete all 6 required units in 1 semester at 1 agency. And a third option is that you can choose to complete 2 different internships for 3 units, each at 2 different agencies. This is usually over the course of 2 semesters. The bottom line is there's no wrong way or right way to pursue an internship experience. Really, I want you to think about what's going to work best for you and to stay open to what those options are. Talk to your academic advisor and make a plan and a strategy about which option makes the most sense for you. Note that many students have really advocated for the value of an internship over the course of 2 semesters, 3 units each semester, and there's some different reasons for that I'll talk about in a minute. So a note on enrolling during the spring semester, you cannot exceed 19 units. This is a university limit on the number of credits that a student can do during an internship semester. We in the College of Public Health cannot override this university maximum. And note that if you have concerns, you can talk to your academic advisor to come up with a strategy for managing your credits. Also note that we do strongly recommend that you take 16 total units or fewer during your internship semester. This is because this is a new experience for students. There are things that you might not be expecting, opportunities that present themselves through the internship, and we want you to be able to maximize those opportunities that are going to arise over the course of the semester. Just from a purely logistical standpoint, this can be even integrating travel time to and from your internship location that can't be counted toward your logged hours for your actual work of either 125 or 250 contact hours. So we really do want you to follow this recommendation that you follow 16 units or fewer during your internship semester. Please also note that tuition and fees are assessed because units are applied to your degree and they count toward graduation. So for spring contact hours, as I've been mentioning, 6 units in the course of one semester is 250 contact hours. Over the course of 15 weeks, that's about 17 hours a week of direct contact hours with your internship site. If you elect to do a 3-credit internship, that's 125 hours over the course of 15 weeks of a semester. That's about 8.5 contact hours per week. And again, those are active contact hours. So sometimes students ask, why this number of hours? Well, again, it's university policy. The U of A dictates the number of hours students will be enrolled in. And what they say is that there's about 45 hours of effort that should be corresponding per unit of enrollment. So if you were to do the math, 6 units times 45 is actually 270 contact hours. Now, because we have an academic component in the public health internship, we've already reduced that to 250 contact hours so that you have that time for the academic components to complete the assignments that will really supplement the learning you're doing on site for your internship. And a lot of students also want to know, when can internship hours count? Internship hours can count starting January 15th, and the last day you can count hours is May 7th. Now keep in mind that when I say 17 hours per week for 6 credits or 8.5 hours per week for 3 credits, this is an average. So if you do less one week, you do more another week. Or you might find that there's an event at your internship, and so you do more hours one week, and then you talk with your preceptor or your site supervisor and adjust your hours in subsequent weeks. The most important thing is that you are on the same page with your preceptor and that you keep your preceptor in the loop about your plans for spring, those internship hours, and the flow of your hours, and how your plans will work together with the internship site. Last note here is that you can start volunteering at your internship site before January 15th, but you cannot officially start recording and logging your hours until class officially starts on the 15th. Again, this is a university rule that contact hours can't begin then, so that's when you'll start tracking your hours. Now I want to go over a little advice from students. The first piece of advice is talk to your academic advisor about what semester you should plan to do your internship. Another piece of advice, really consider doing your internship over 2 semesters so you can get a deeper view of the agency work. The benefit of doing 2 internships is that now I have a larger professional network. Some more advice. Because many opportunities come up during your internship, limit your other commitments so that you can take advantage of these cool experiences. Yes, you definitely want to do that. That relates back to limiting the number of hours, of credit hours you take during the semester you do your internship. And then when planning your other classes, be sure to build in time it takes to get to and from your internship site. Another good piece of advice. So now I want to talk about the different responsibilities during the internship for you, for me as the internship instructor, and for your preceptor, and that's your site supervisor at your internship site. So I'll start with the responsibilities for you. First, what's important right now with this internship orientation is that you understand the internship criteria. It has to be public health focused. You need to meet certain prerequisites to be enrolled. You want to aim for 250 contact hours for a 6-unit internship and 125 contact hours for a 3-unit internship. It's your responsibility to search for internships, and I'm going to share some tips on how to do that in a minute, but know that you'll really be the driver of that experience. It's your responsibility to be professional when you're reaching out. You never know what contact might lead to that internship site, so always be professional, and I'm here to help if you have any questions about that. It's also your responsibility to communicate your interests and needs, including public health focus and the contact hour requirements, to any potential agencies and preceptors. And you need to complete college and agency paperwork for enrollment in your units. And again, it's important to be professional through all of this because you want to start out on the right foot and really be successful with your professional communication and presentation at your internship site. Even if you don't end up with an internship, it could be a contact further down the line. Now, the responsibilities of me, the internship instructor and coordinator, I will share opportunities with you about internship sites, primarily via postings on the Hub, and I'll talk a little bit more about the Hub in a minute if you're not familiar with that. I will review your work plan and work with your advisor to get you enrolled for your units. I'll serve as an ongoing contact with you and the preceptor as you're getting everything set up with your enrollment, and then also during the semester when you're doing your internship. And I will grade your internship assignments and assign your final internship grade. Now, the reasons that there are assignments and a final grade, well, this is federal regulations. They require that all internships for credit include work experience and an academic component. So that's where I come in. You will have these academic assignments throughout your internship, but I don't want you to stress about that because a lot of students have shared that the assignments have really helped them process the learning, and that's the ideal, that you are having this additional opportunity. There's a reflective component, there's some writing components you'll share online in a discussion at one point when you create a LinkedIn profile. So this is really not designed to be busy work. It's all designed to inform and supplement your on-site experience at your internship and link your applied experience to public health. The responsibilities of the preceptor, and now this is your site supervisor at your internship. The preceptor will work with you to design and sign off on the public health focused work plan and complete any other required forms. Your preceptor will provide mentorship to you as an intern. They will answer any questions and resolve any issues that arise. They will discuss any issues with me, the internship instructor, and they will complete your midterm and final evaluations and sign out on your activity log. Now, note that you'll often get to know your preceptor really well during this experience. I hope that you do. So you may down the line be asking for a letter of recommendation or a reference call for a job application. So again, you want to really be working on professional communication, keeping them in the loop, really cultivating that relationship, using your strong social emotional skills so that you can have that reference further down the line. So remember that your first impressions are going to be important, so be professional and respectful with your preceptor. If you have any questions about what this means to be professional, you have any questions about how do I fit into a workplace culture, please do not hesitate to contact me. Like I said, I've supervised students going into job sites before, and I've also been a director of education supervising U of A interns. So I'm here for you. I really like this coaching and mentoring part of this job. So I'm really excited to support you through this process. Now, some more advice from students. Make a copy of the agency and preceptor responsibilities from the internship manual and give that to the preceptor when you're asking about opportunities or interviewing for a position. Great advice. You want that preceptor to really understand what their responsibility is going to be and what your availability is going to be. So now some tips on finding an internship. So great news, public health is everywhere, so you can be anywhere. So in other words, you're not limited to Tucson or Phoenix or Arizona. or wherever you're located, especially for you online students. My network is primarily in Tucson, that's true, and some in Phoenix and Arizona, but you are going to be the driver that's focusing this internship search, so you can look anywhere, and I really encourage you to do that. If you're an online student, you want to be able to search someplace in Kansas, in California, wherever you are, Illinois, Chicago, so that you can be finding an experience that's going to work for you. But you may also be in a situation where you want to travel to that internship experience. And we've really had students all over New York, California, Atlanta, Peru, Australia. We have a student right now that's looking for an internship in Spain for this coming summer, 2020. So the sky's the limit. So really think about how this internship experience will fit in with your other goals for your undergraduate career, and then really go for it and search a lot of different places so you feel like you're going to be really happy with the internship that you select in the end. You also can do a remote internship. This means that you can be someplace separate from where your agency is. The thing to note here is that you're going to have to be really self-directed to be successful. You're going to have really top-notch communication, and make sure that you're comfortable communicating a lot in writing, because you're going to want that to secure the job responsibilities, that you're comfortable doing Zoom and phone contact with a site supervisor. So you'll really want to think about what you need to be successful, and let me know what kind of supplementary help and support I can give you through that. So here's some tips for finding a great internship site. Start looking now. That's number one. You want to be looking right now so that you can be securing something for spring or even summer. You want to tell everyone you know, your whole network, that you are looking for a public health focused internship. So let your friends know, let your classmates know, your instructors, your parents' friends. Take advantage of college and university resources. Talk with your academic advisor about your interests. If you have guest speakers come to your classes, or if you go and see someone speak on campus, be brave and approach them afterward and talk about how you are looking for a public health internship. Look at the college and campus announcement emails that you're going to be getting, and use online resources like the Hub and Handshake, and I'll talk about both of those. So the Hub is our public health source for students, for faculty, for staff, for graduate students as well. But for you as a student, the Hub is probably your first stop for where you're going to start looking for an internship. So you go to publichealth.arizona.edu, go to that webpage, and then you can see the public health login. So you'll log in using your net ID and password. Then you'll go to the tab at the top that says undergraduate students. On the right hand side of the page, the tab that says internships. And then as you page down below, the undergraduate internship opportunities. So once you're there, and you can see this down at the bottom right hand side of the screen, you will find a variety of opportunities listed for you. They're actually going to be organized by term, so by spring, fall, or summer term. We've had students doing internships in the community for over 30 years, so many organizations now come to us looking for a great public health intern. That's where you come in. So the Hub is a collection of these different ads from different organizations throughout the community. So you'll want to review the opportunities posted on the Hub. Even if an announcement says that it's passed, don't hesitate to reach out and let that internship site, potential internship site, know you're interested in their work, and you're wondering if there are other ways that you could contribute to their projects. You can ask them, you can email them and ask, can we set up a meeting to talk about opportunities? If they say yes, great, set up that meeting, take in some of the materials that we've talked about, go in and be professional and talk about what you can bring to their organization and what kind of projects you could help with. If they say no, that's okay too. You're building your network, so you simply can ask if they have contacts in the community or in their organization who are doing similar work that you could reach out to. Now, the other valuable thing about going to the Hub is it's going to help you really get some insight into keywords that you can use for your own searches when you go on Google and do a search of your own. So as you can see here, there are some keywords already: childhood obesity, wellness program, sexual assault crisis advocates. So you're going to be able to pull some keywords, and then when you go to Google, you'll type these in. So you might type in healthy habits or epidemiology in Tucson. You might type in sexual assault prevention, employee wellness program, Phoenix. So you can also specify by location when you're doing that Google search. And then you'll find opportunities because you found those keywords from hub postings. Now, this is especially a good strategy if you're looking outside of Tucson, because most hub opportunities do come from Tucson locations. So especially if you're fully online or if you want to go someplace else, finding these keywords and then taking the initiative to do your own Google searching will be really critical for you. And this is where you're going to get great ideas, so you won't be starting from scratch because you'll have the help with those keywords from the hub to get you started. U of A also has this great resource called Handshake. If you're not familiar with it, you can check this out through the U of A Career Services platform. This offers internship and career opportunities throughout Arizona and really throughout the world. They're both paid and unpaid. So you go in, you create an account, and the more you complete your profile, the more opportunities will become available to you. And another thing that's pretty great is that Handshake's available even after you graduate. So as you are searching for jobs post-graduation, you can continue to use Handshake. I want to encourage you to think outside the fishbowl. So what does this mean? You do not have to do an internship. That's really interested in finding an opportunity with an organization that you know about and you want to bring your public health insight into that organization. So maybe you are really interested in the work that Emerge Center Against Domestic Abuse is doing, and you can go and approach them and say, I want to work with you. So thinking outside the fishbowl is your way to approach them about an internship. Again, making sure that it's public health focused, and you'll set yourself up with a great experience. So I also want to encourage you and let you know that there is going to be a little bit of bravery required here. So be brave. It's 100% okay to make cold calls as a first point of contact. And what a cold call is you've gone to Google, you've found some information about an organization that you're excited about, and you find that person's contact number and you give them a call. And then you can follow up via email as well. But this is a great way that a lot of our interns have found opportunities during their undergraduate years. So they may have gone to Google, they found 3 or 4 different job sites that were potential for internships. They reached out via phone call or via email. A lot of times it's easier to reach out via email at first. And cold calling can be considered sending that cold email. And really introduce yourself. Think about how you want to approach this organization, what you have to offer them, and hopefully you'll have some offers that come back to you, opportunities to talk on the phone or in person. But really I want to encourage you to just take advantage of opportunities, use that Google search. You don't want to miss out, and you never know what's out there if you don't try. You also want to be thinking about practicing your elevator speech. So an elevator speech is something that you want to have practiced before you, especially before you do a cold phone call. And it's typically about 30 seconds, which is about the time that it would take to ride in an elevator with someone from the top floor to a bottom floor of a tall building. So you want to introduce yourself, say who you are, your interests, focus on what you can do for the agency. Remember, you want to be brief and speak confidently, but you want to speak about your public health interests and what you can offer to that agency. Remember, the only internship you don't have a shot at is the one you don't seek out. So really, again, getting back to be brave, getting back to thinking creatively. Reaching out doesn't commit you to accepting something. It's a two-way street here. You're in an information gathering phase, so you want to be professional no matter what, because something might pan out and turn into an internship. But if it's not the right fit, it is okay to reach out and communicate that you found another opportunity, you really appreciate their time, and again, I'm here to coach you through that and help you strategize around how to do that communication. You want to be really prepared, and when you are approaching somebody for an internship, you want to be able to orient the agency and the preceptor to you. So you want to take a copy of your resume. You want to orient them to public health, so share with them your definition of public health. You also may want to be prepared to explain the differences between clinical health and public health. because again, a lot of people don't really know that difference in the community. You want to orient them to the internship experience itself. So take a copy of your internship manual so that you can help them understand what the expectations are for you, for them, and for me as the instructor. And finally, again, you want to be professional in all inquiries and interactions. You can see I keep mentioning this, so you can see it's really important. You want to leave that great first impression, and you want to really set the tone that you are prepared to be professional in their organization. Some more advice from students here. Start your search as soon as you finish this orientation. This is so important. Yes, we love it when students are being proactive early in the semester. Talk to your classmates, friends, parents, mentors, advisors, everyone. Again, building that network. Actually practice your elevator speech ahead of time. I love this idea. Create a spreadsheet of agencies that you reach out to and or apply to. Really another great idea. Before doing an interview, review the agency website and think about your answers to common interview questions. Inquire to see if you can shadow current interns or volunteer for a day before committing. Excellent idea if you've got the time. Send a thank you note or email after the interview or visit. I think at this point a thank you email will suffice, but you want to let them know that you really appreciated their time. A little bit more advice. The more times you put yourself out there, the more likely you are to get your dream internship, absolutely. And use Dr. Grunwald and your academic advisors as resources as you start your search. Yes, 100%. Please use me. Please use your public health academic advisors. We are here to help and support you. This really is an exciting experience that you're going to have, and it's really fun for us to help you find that great experience. So how do you get enrolled in the internship, in the pre-internship course? So how do you get enrolled in this prep course? So you need to use the templates provided on the Public Health Internship Prep D2L course site. So this is getting you ready for your spring enrollment. So there's a work plan that you'll find there, and this incorporates a university mandated assumption of risk and release form, and you'll also find a preceptor agreement, and I'm going to go over both of those. So the internship work plan is completed by you. You need to complete it ahead of time. I provide the template on the D2L internship prep course site, and there's a screenshot of that form in the lower right hand corner of your screen there. So part of the work plan is completed by you. You can do that ahead of time, and then part of it you'll complete with your preceptor. You'll work together on the purpose statement, the learning objective, and the proposed activities. It's really key that you're specific and ambitious with these, but it's also important to remember for you and for your preceptor, this is a work plan and plans change. And that's okay, as long as the internship continues to maintain a focus on public health. And please keep me informed if you do change your work plan. I want you and your preceptor to think of this as a working document, because there may be something that comes up for them where they want to shift your work responsibility. And so you want a way to have that accountability and to keep me in the loop so that the preceptor is accountable as well. The internship work plan and the reality of that should not be this. Look, this internship is not about coffee runs, filing papers. It should not be a burden or a thing to do just to graduate, but a great opportunity to make meaningful contributions to the agency and the community. I will strategize with you if that is not the case, because we're going to need to get something changed so that it's meaningful for you. So please keep in mind, you are not there to do completely unfulfilling grunt work. You should be having a meaningful learning opportunity at your internship agency, and I'm here to support you in making sure that that happens. So the preceptor agreement is the form that's used to confirm that the preceptor understands their role and that they have accepted those responsibilities, including mentoring you and turning in required deliverables like the activity log and the evaluations. It is a requirement of the College of Public Health that the preceptor is in their role in the agency for more than a year, and that's because we want them to have more knowledge of the agency than you have, and we want them to have supervisory experience so they're not learning that on the job as they go along with you. So we really want to make sure you have an experienced preceptor who's going to be able to fully support you with this experience. So here's an example of the preceptor agreement. Note that we also need a copy of your preceptor's CV, resume, or biosketch for our files. If this is a preceptor who has previously worked with the College of Public Health and they've provided one before, then that's fine, and you can just note that on the form. So here's some due dates for those required forms. For your spring internship, the deadline is December 16th. I know that seems a really long way away, but please note that December 16th is going to creep up on you, that you may need some time to get some forms filled out on the agency side in addition to here on the university side. And you're going to want to turn all those required forms in using the D2L Assignments tab on the Public Health Internship Prep page that you'll have access to once you complete your paperwork after watching this video. So there is a dedicated D2L site. This is important because this is where you'll find those documents, those templates that you're going to need. Once I add you to this internship prep course site, you will go to the content page and you'll want to go to the important course information and documents. On this page, you will find the slides to this PowerPoint presentation. You'll also find the internship manual. Make sure you read this and share it with your preceptor. You'll find the work plan and the preceptor agreement. And the assignments tab is where you will turn in and upload your work plan and the preceptor agreement. And that's where I can review them. And once that review is completed, then we can move forward with getting you enrolled. So some agencies have some additional requirements. This is why we want you to get this internship prep work done sooner rather than later. You don't want to be waiting until the last minute. They may have additional required forms and steps for you. Some that are common are an affiliation agreement, especially common for internships out of Arizona, background checks, or a TB test or other medical proof of health status. So start your search early. This will allow you time to get all the required forms and steps completed. More advice from students. All good stuff here. Do not accept an internship if you're not sure about it being a good fit for you. Absolutely. Do not do that. Really take the time. Start early so that you can find that right fit. I don't want you to feel like you're stuck someplace. Talk to Dr. Gronwald if you aren't sure how to ask for more time to make a decision or decline an internship. Absolutely, I'm here to coach you. And know that your preceptor may take time to complete their forms, so start working on them ASAP. Absolutely. I want to just take a moment right now to acknowledge that you're learning, which means you don't know everything, that you're human, which means mistakes can happen, and I am here to help you strategize. So I think this is really just in the social emotional realm of things. This is really important to acknowledge so that we can be practicing some self-care, some public health kindness toward ourselves when we're trying to get things done. But again, all the more reason to get things started early so that you don't feel like, oh no, time is such a crunch that I just am making mistakes now. And I also want to reassure you that any information you share with me is confidential. So as things come up in the internship search and in the internship class, sometimes you're going to want to know that you have a confidential ear here, and I'm here to help you with that. And I will not share anything critical with your internship site without you and I agreeing on that. I want to talk about the assignments that you'll have when you're actually doing the internship. Yes, there are a few graded assignments. Again, this is because federal regulations require an academic component in addition to a work experience. And so in addition to your contact hours, those are those active hours that you'll log at the internship site, public health students will spend about 20 additional hours working on internship assignments. But please be assured this is not busy work. These assignments are really designed to help you reflect on your learning and make this internship an even more positive experience. So a few common questions that come up. Why don't you just assign me an internship? Students often ask this question. Well, that's because you're all unique as students. You have different interests, you have different post-graduation plans, and you know best what you want to do for your internship. I don't want to mandate that you work at the community food bank if you have no interest in working in food security for your career. So that's why you search for the internship using all the resources I've discussed. This also prepares you for the job search because no one's going to just be there giving you a job after graduation. So while I don't assign you an internship, I am here to support you with an internship. And so I'm here to talk about it and strategize with you. Can I get paid? Yes, absolutely. In the dream world, all internships would be paid. Unfortunately, that's not the case right now, but you can absolutely seek out paid opportunities for your internship. Can I do my internship at my regular job? Maybe, potentially. The university has specific rules about doing internships at a person's regular job. So if it's an opportunity that's of interest to you, let me know. If it's public health focused and if we can identify new roles, then it's possible to do an internship at your regular job. But there's no guarantee. And there also are advantages to doing that internship elsewhere in terms of building your network and diversifying your job skills. So keep that in mind if that's something you want to weigh as well. Does my internship need to be in Tucson? Definitely not. In fact, it can be anywhere in the world, so sky's the limit. Really get creative with how you want to think about that. Can I do multiple internships? Yes. As I mentioned, there are a few different options, 2 different internships at 2 different job sites over 2 different semesters. And students can even do a 3rd internship if you choose to do an elective internship. Do internships lead to jobs? Yes, absolutely. Every semester, students get jobs through their internships. If not at the internship itself, sometimes with a community partner that they've worked with through building their network. This happens every semester, and it's always really fun and fulfilling. And will my internship be valuable and fun? Yes, your internship should be an amazing experience. Students really learn so much about themselves, about what they want for their careers, about their community. So if your internship is not valuable and fun when you're doing it, please reach out to me so I can help you strategize around that. Sometimes that might mean revisiting the work plan, but we will do the best that we can to make sure your internship is valuable and a rewarding experience for you. A few required notices here. The internship instructor, college, and university are not responsible for any financial obligations, including but not limited to travel, transportation, housing arrangements, medical care for injuries related to the internship experience. So what's your next step? You want to complete the worksheet that you printed out and hopefully have been filling out over the course of this video, and email that to me at laurag1@email.arizona.edu. And then once you have turned that in and I've evaluated it, you will get access to the dedicated public health internship prep D2L site, and then you can start moving forward with your internship search, and you'll find the work plan and the preceptor agreement on there. If you have any questions, please get in touch. Really don't hesitate to keep me in the loop on what's going on with your search, with your process. Again, I'm Dr. Laura Grunwald. You can send me an email at the email address I just shared. Here it is on the screen. I've got office hours scheduled by appointment and available in person, by phone, or video conferencing. And feel free to also lean on the Public Health Undergraduate Advising Team. Abba, Melanie, and Grace are all terrific, and we're all here to help you. We know what a cool experience the internship is, and I'm so excited to work with you as you get that set up and once you're in the class. So thanks, and have a good day.